The kids are in school, and there's no question the cooties are flying around, from the common cold all the way to the flu and many more viruses. There's so much going on, and I'm going to address that. On this next episode of Ask the Doc, no appointment needed, I'll address your concerns, answer questions about the different viruses that are going around. I'll give you some pointers on how to keep your kids safe and in school. Stay tuned.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Hi, I'm Dr. Scarlet Constant, board-certified pediatrician and founder of Constant Care Pediatrics here in Miami, Florida. Welcome to Ask the Doc, No Appointment Needed, a show where we have you viewers send in your questions and I will answer them in real time. It looks like we have a question coming in now from All Health TV app. This question is from Chase. My toddler son came home from preschool with a note saying one of his classmates has hand, foot, and mouth disease. What exactly is that? Is it contagious? What should I be doing to protect my son? Well, Chase, why don't you take a look at this video from our friends at the Mayo Clinic, and I'll get to that shortly.
Rashes. They are common in young kids, especially babies.
Hand, foot, and mouth is spread through respiratory droplets. It can also be spread through the stool of an infected person, and so that's why hand washing is really important. It can also be spread through fomites, so touching something that an infected person has touched before. For that reason, we do see that it spreads pretty easily, especially in places where there's a lot of young children.
Dr. Nipuni Rajapakse says while highly contagious, the virus is usually mild.
It can be quite painful and uncomfortable, especially the lesions at the back of the throat that can make it difficult to eat or drink.
There are no specific treatments, but there are things you can do to help your child feel better.
If they're having a lot of pain or discomfort with the rash, you can give them ibuprofen or acetaminophen to help with that, and making sure that they're staying well hydrated, drinking lots of fluids. Things like popsicles can help if they're having a sore throat.
Seek medical attention if your child's signs or symptoms worsen after a few days. For the Mayo Clinic News Network, I'm Jason Howland.
So as mentioned in the video, hand, foot, mouth is a virus that is spread predominantly in daycares and preschools. And the reason why is because this is an environment where children are sharing toys, touching toys, and actually putting them in their mouth. So therefore, the spread by fomites is happening on the mats and with the shared toys. And in daycares, we still have infants or young toddlers that are in diapers. And so because there is the changing of the diaper and maybe cross-contamination with the stool, then you're able to spread hand, foot, mouth so much faster in these environments. So usually it's spread between the infant up to the young toddler years. And again, to reiterate, hand, foot, mouth is self-limited, meaning it does resolve on its own, but you do have to initiate supportive care. There's a lot of, pain, itching, discomfort involved. Sometimes your child won't eat because of the lesions in their mouth or on their tongue. And so that will cause pain and discomfort, and they usually will stop eating or drinking. So it's very important to try to control the pain and to hydrate your child as much as possible so that they don't end up in the hospital with dehydration. Other than that, the rest of the management is just supportive care and waiting for the virus to resolve on its own. Okay, it looks like we have a question coming in now from Facebook, and this question is from Jenny. My friend and I were having lunch the other day, and she mentioned something called RSV. What exactly is that? How dangerous is that for my baby? And are there any things I can do to prevent it? Well, Jenny, RSV stands for respiratory syncytial virus. And let's take a look at this video from the Mayo Clinic just to explain a little bit more about it, and I'll get back to your question. helpful. And as I mentioned before, RSV stands for a respiratory syncytial virus. RSV is prevalent usually during the fall and winter months. However, in some places, especially warm climates such as South Florida, we tend to see the virus throughout the year. Now, RSV is dangerous usually in the younger age groups under the age of 3 or 4, and that is because RSV causes thick mucus plugging in the underdeveloped lungs, and making it very difficult for the younger children to expectorate and to clear the mucus plugging, therefore causing a lot of respiratory distress. Now, this is not to be confused with asthma or with pneumonia. It actually is more so referred to as a reactive airway or bronchiolitis because there's a lot of plugging in the lungs, causing coughing, difficulty breathing, nasal congestion, but not responsive to typical treatments such as albuterol, which is a bronchodilator, or even antibiotics for pneumonia. RSV is viral, so we really don't have a treatment. The treatment is more supportive care. That meaning suctioning out the mucus, helping the infants cough by patting their back. We call it chest percussive therapy, kind of patting their back gently to loosen up some of the mucus plugging. And really important to give saline, sometimes that dilutes the thick mucus plugs, and finally to hydrate. It's very important to hydrate our patients that are affected with RSV because with the increased work of breathing and the mucus plugging, they're burning a lot more calories, they're losing a lot more fluids from their body, and they're also not eating or drinking, so it's a recipe for dehydration. So one of the really important treatment measures is to hydrate these young infants. And again, it affects younger children under the age of 4 more severely than those that are older due to the underdevelopment of the lungs. Now, how do you keep your child safe from RSV? Of course, it's very difficult. But if it is an infant, for example, you really want to keep them away from crowded places during the fall and winter months. For example, going to the mall, going shopping, big crowded, busy restaurants. That's where you're really going to be at risk for RSV. If they're actually exposed to school-age children that might carry RSV but not really be affected by it as severely as infants. For example, there are some preschoolers or elementary school kids that might have RSV and it presents as a common cold. However, if they bring that what looks like a common cold to an infant, it will present with respiratory distress and sometimes even hospitalization. So I really would keep them away from maybe school-age kids or crowded places. And of course, it's important if they're of age to get vaccinated to at least get the flu vaccine. If the RSV vaccine is not available to them, the flu vaccine really does help because we see a lot of cross-infectivity with RSV and the flu. So I hope that this helps. I know that was a big mouthful, but you know, RSV is very important and it is very serious in the infant and young toddler population. So I really want to make sure that you understand it and you're able to protect your child. Okay, looks like we have a question coming in now, and this question's from Mel. How do I know the difference between a cold, the flu, or something more serious? Well, Mel, it is very hard to tell sometimes, especially when symptoms overlap. I would say honestly that if your child has the symptoms of a cold or flu, whichever one, meaning fever, a runny nose, nasal congestion, coughing, just feeling overall down, you really want to watch for severity. Is it getting worse over time? Is it stabilizing, or is it even getting better? Because that's a really easy way for you to determine whether or not you need to see your pediatrician and then therefore get tested and find out exactly if it is in fact the flu or something more serious. So with a common cold, you'll have symptoms that last anywhere from, up to 2 weeks. You'll have your runny nose or stuffy nose, a sore throat and a cough. But really, you should see the symptoms start to get better in about 48 to 72 hours. You would treat a common cold with over-the-counter medications. And like I mentioned, you should maybe see a fever for a day or two, but things really start looking up after 48 to 72 hours. But if you find that the fever is persistent or there's more body aches and pain and headaches, now we're thinking maybe this might be the flu. The flu almost always comes with a headache or some form of body aches. The cough might be a little more productive. Now we have associated chest pain. And again, the management might be exactly the same, but it would be good for you to know if you're dealing with a common cold or actually influenza. And so that would be a reason, having a persistent fever or pain would be a reason to go see your pediatrician and then determine whether or not it's the flu or something else. I hope that this was helpful. Now, if you guys want to send in your questions, because I know that so many of you have a lot to ask, please take a look and see how to do so.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, well, it looks like we have questions coming in now. Here's a question from Kenneth. I have been questioning whether I should have my kids vaccinated for the flu or not. Can you share some of the pros and cons with me? Kenneth, sure, I'm happy to discuss this with you. The flu vaccine is offered every year, and the reason why it's offered every year is because there are different strains that are more prevalent from year to year. So by the end of the summer, new influenza vaccines are prepared in order to combat the more prevalent strains that are coming out. Now, why is this beneficial? Well, the flu can be pretty tough. Like I mentioned before, it's associated not only with fever and nasal congestion, but we can also develop some serious respiratory symptoms such as deep productive cough, mucus plugging, wheezing. Sometimes it even gets complicated to pneumonia, causing shortness of breath, and even long-term effects after the infection with the flu. There are a lot of body aches, headaches, pain. And being vaccinated against influenza, while it might not protect you from ever getting influenza, if you do still get it, it will be far more mild than it would have been if you weren't vaccinated. And this is very important, aside from feeling better and not having to be home feeling miserable and in pain, and of course preventing maybe a complication such as ear infections, pneumonia, sometimes even encephalitis could even happen. But more than that, it is very difficult to miss school and have parents miss work and everybody stay home and kind of stop their lives because they have to be home sick. It is great to have the ability to get better in 24 to 48 hours, feel better, not worry about complications, and then get back into the game, which is what we want. So those are some of the pros. The cons of getting the flu vaccine, of course, is fear of the needle. Right? Most kids just don't want to go to the doctor's office. They don't want to get an injection. They don't want to feel the local pain. But that discomfort is just a minor disadvantage compared to the benefit that you're getting from getting the vaccine. And if you really don't have time to get to your doctor's office, or your doctor's not offering quick appointments to get the flu vaccine, then you can always go to CVS or Walgreens or your local pharmacy and get it right away. It's very easy, and it shouldn't be a deterrent. I think it's really important to protect yourself and your family in order to prevent further illnesses or complicated illnesses. I hope you go get your flu vaccine. So it looks like we have another question coming in from Facebook, and this is from Lourdes. My husband booked a cruise for our family, and although I'm excited, I'm really nervous about some of the viruses I've heard about that sometimes appear on cruise ships, like rhinovirus, enterovirus, and adenovirus. Can you explain what those are? Also, what symptoms should I look for? And what can I do to prevent our child from getting sick? Well, Lourdes, this is a valid point. It is very difficult on a cruise ship. You literally on a huge vessel enclosed with people, tons of viruses are going around and there's nowhere for you to escape. So that's a legitimate concern. But I think that's par for the course when you decide to go on a cruise. I think it's important to make sure you're up to date with all of your vaccines, and so are your children. You practice hand washing. You make sure that you're not sharing drinks and cups. And if you put something down at the table, you don't go back later and grab it and pick it up and drink or eat from it. These are just like the typical precautions that we practice when we don't want to catch a virus from someone else. Sometimes, again, on a cruise ship, it's inevitable. You're in close encounters with people and there's nothing you can do about it. Now, to go into detail about the 3 viruses that you asked about, adenovirus is pretty common in the school system. You'll see it in class, and that's usually a virus that causes very high fever, sometimes a rash, pain, red eyes, and like a conjunctivitis, which is irritation of the conjunctiva in the eye. So that's a virus that's self-limited. All of these viruses are self-limited. They get better in 3 to 5 days. You just have to hydrate, take IV anti-inflammatories or antipyretics in order to get better. Rhinovirus is just another word for a common cold. That's inevitable on any vacation. We again practice hand washing, make sure that you are vaccinated and healthy and your immune system isn't suppressed, and you should be safe. So rhinovirus is a common cold. And I think the last virus that you mentioned was there was adenovirus, rhinovirus, and enterovirus. So enterovirus is actually a little harder. That is sometimes can give you gastroenteritis symptoms such as vomiting and diarrhea, stomach pain, and that's pretty tough, and that spreads very fast, just like the norovirus. And what you certainly want to make sure that you are always washing your hands before and after eating, and make sure again that you're eating your own food and not sharing with others, because that is a virus that spreads very quickly. So good luck, and don't think about this. Hopefully you'll be safe on your cruise, and just make sure that you keep yourself healthy and your kids are healthy, and stay up to date with your vaccines so that your overall immunity is up to par and ready to fight off any virus or bacteria that comes your way. Okay, it looks like we have another question coming in, and this is from Jan. My daughter likes to bring my grandson to the mall and let him play in those yucky play areas. I hate it and feel like they're really full of germs. They say they clean them, but am I off base? Or is she putting my grandson at risk of getting sick? Hi, Jan. Well, yes, of course, the play areas with toddlers are always just a breeding ground for tons of bacteria and viruses. But you can't live your life in a bubble. Your child can't be in a bubble. They're going to be exposed to bacteria and viruses no matter what you do, whether it's a playground at a mall or the playground outside at the park or just going to school every day. So, I think that as long as she's making, she lets her son play and then washes his hands, cleans his hands with hand sanitizer when he's done, doesn't let him, play and then grab something to eat and put it in his mouth, then he should be pretty safe. I think that's, the way you have to navigate is just make sure that we're not cross-contaminating, we're not eating with dirty hands, we're not going to the bathroom and wiping ourselves with hands that have been contaminated with a virus. Then, as long as you're making sure that you're practicing good hygiene, your kid should be safe and fine. Okay, so if you want to send in some questions, we still have time. Take a look at this video.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back, and it looks like people are pretty concerned about these viruses. Like I mentioned, the cooties really are going around right now. Let's see. It looks like we have a question coming in from Lisa. One of my son's classmates came down with pink eye. I've heard it's very contagious. What exactly is it? What causes it? And how should it be treated? Well, Lisa, yes, pink eye is conjunctivitis. That's a viral or bacterial infection in the eye. What we commonly call pink eye is typically a viral etiology, meaning it is a viral illness. It causes inflammation in the conjunctiva, causing redness, itchiness, burning, and sometimes discharge from the eye. Usually is localized to one eye, but sometimes we pass it to the other eye by rubbing and touching it. It is contagious in that it is spread from the eye secretion. So if you touch one eye, rub one eye, and you touch another eye or touch your friend or touch someone else, you'll pass it very quickly, which is why it's so common at school. So the treatment is usually prescribed eye drops. And this is because it's very difficult to tell the difference between bacterial versus viral conjunctivitis. And because the spread is so fast, we tend to err on the side of caution and just treat everybody as if it's bacterial. So we do treat with a bacterial, with an antibacterial drop that is usually 3 times a day for 7 days. And your pediatrician would prescribe this. Okay, and actually, if you're wearing contact, or if your child wears contact lenses, you absolutely want to throw out those contact lenses as they have been compromised with the virus. So they do need to get a new set of lenses if they have contact lenses. Okay, so looks like we have another question coming in from Facebook from Dana. My child was sick and our doctor prescribed an antibiotic. My question is, are antibiotics bad to start at an early age? Can kids become immune to antibiotics? Well, Dana, I believe that if your pediatrician prescribed an antibiotic for your child, it's because it was absolutely warranted. Despite the age, if a child has a bacterial infection that will not clear on its own, can only be cleared by antibiotics, then they're going to have to take them. And no, we don't love prescribing antibiotics to young children. Of course, you want to wait until they're a little older, until their gut flora has really colonized and is a little stronger. But like I mentioned, there are some illnesses that need to be treated and you don't have time to wait. So they do have to take antibiotics. Now, does this mean that your child will have long-term effects in the future? Absolutely not. The concern with antibiotics isn't so much how early it started, it's about how frequently they're prescribed. Yes, a child that takes antibiotics very frequently will not necessarily become immune, but instead the bacteria will become resistant to the antibiotic. And so you do not want to have an instance where a child continuously gets infected by bacterial strains that are totally resistant to the common antibiotics that we prescribe. So that's with frequent antibiotic use or prescription. And then in the long run, as far as just long-term effects, yes, you're getting rid of a lot of very good gut flora, and you want to restore that because antibiotics actually kill the gut flora, causing diarrhea and other complications down the GI tract. But again, this is with frequent use rather than early use. I hope that your daughter gets better soon. So we have a question now coming in from the All Health TV app, and it's from Spencer. My son constantly gets ear infections. Why would they be so prevalent for a 4-year-old, and what else can I do for him? Well, Spencer, there are many reasons for children to continuously get ear infections, and if your son is responding to antibiotics but continuously gets infections, I would suggest that you speak to your pediatrician about it because there may be something else going on. For example, eustachian tube dysfunction, where the eustachian tubes are angled in a way that incorrectly drain the fluid from the sinuses directly into the ear. Maybe it's environmental and your child is somewhere where they're constantly catching bacterial infections. There are many reasons, so we certainly want to explore that with your pediatrician. But I will say that it is common to get multiple ear infections in early childhood because the kids are often sick. Remember, an ear infection, which is called otitis media, is actually inflammation behind the tympanic membrane. So fluid and mucus secretions are draining from the nasal sinuses into the ear canal, thereby colonizing bacteria and causing an infection. So you cannot get an ear infection without first having some type of head cold or common cold or flu, anything that's going to cause thick nasal secretions, which will then thereby drain into the ear. So what I would say to prevent this from happening is the second you see that your child has nasal congestion or a runny nose that's lasting more than 2 or 3 days, really try to get ahead of it, whether it's by suctioning the nose, using saline irrigation, whether it's using nasal steroids or even decongestants, depending on the age of your child. Anything you can do to minimize the nasal secretions and sinus buildup will prevent the ear infection from developing. And again, if those measures are taken and your child still tends to get ear infections, you really want to have a healthy discussion with your pediatrician about that and maybe even see an otolaryngologist. Okay, I think we have time for one more question. Let's see if there's anything else. Sandra wants to know, hi, Dr. C. My son is in middle school and burns the candle at all ends. He goes to school, plays sports, comes home and plays games, and then finally gets to his homework. I hear him in his room late into the night, but when I check on him, he really is doing homework. How do I keep him from getting burnt out or getting sick? Well, Sandra, it sounds like your son is taking school very seriously and he's working really hard. And it's kind of hard at this age to really control them and tell them to get to bed early and try to take care of themselves. I mean, the best thing you want to do is help him maybe manage his time. Maybe he's not managing his time effectively. So you can give him guidance with time management and then just give him some ideas about healthy options and good sleep and making sure he's taking his vitamins to stay healthy. But otherwise, he's gonna learn on his own that after a while, there's a point where he needs to know where his limits are and when he's gonna have to take a break. And unfortunately, that's a lesson he might need to learn on his own. I hope that that helped. Thank you so much for watching and stay tuned for the next episode. Have a great day.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.